Hello, this is Dr. Harriet Fraad. Welcome to Capitalism Hits Home, a podcast about the intersectionality and mutual shaping of home life with political, economic, and cultural life in America today. Today, I want to talk about the American sad phenomena of death and addiction. Life expectancy, how long you live, has gone down in the United States in recent years in a way that has not happened with any of our wealthy counterparts in Europe, in Scandinavia. We are dying sooner. Of course, not all of us. Select populations are dying sooner and therefore increasing our death rate and decreasing our chances to live. Part of the reason that our death rate is higher is we have the highest rate of COVID in the world. 771,000 people have died in the United States, thanks to our president for denying that we ever had COVID in the first place, our inadequate protection, because it does pay to storehouse medical equipment, and we managed to storehouse lots of weapons, but not medical equipment. They want to sell that and make a profit. In fact, Trump did just that. He sold our protective equipment stockpiles. In any case, we are doing badly in terms of life expectancy and addiction. Drug deaths are more than 27 times in America. 27 times greater than drug deaths in Italy and Japan. And they're double the rates of places like wealthy, happy countries like Sweden and Finland, where they have twice as few deaths as we do. We have twice as many deaths, even though they were vulnerable and had COVID deaths. So that's a remarkable thing. 100,000 Americans died between, it's May of last year, 2020, and April of 2021. Quite amazing. Not even a whole year and 100,000 deaths of overdose. Why? Why do we live more than 2.5 years less than countries that are other wealthy countries or the Scandinavian countries? Why, when we are the richest country in the world? We're almost a decade behind the standards in Scandinavia and other wealthy countries. But it isn't all of us. We're not all dying. It's select populations that are dying of addiction. Those are written up really well in this book that I'll hold up and hope is visible, called Deaths of Despair. It's by Anne Case and Angus Deaton. Anne Case is a professor at Princeton University, and Angus Deaton is they're both economics professors, an economics professor at UCLA, and he is a Nobel Prize winner from 2016. They wrote this very good book about deaths of despair, in which they show that it's not only all Americans who are dying, and they wrote this before we reached our 100,000 OD deaths, overdose deaths, in a year, but they talk about the epidemic of death across the United States, who it hits and where it hits. One of the reasons it's hit the United States is that our country does not trust its leaders. First of all, Trump denied that there was a problem in the first place. He denied there was a pandemic when he found out about it in December 2019. but also because there's too much lying on the part of the government. They feel lied to. And they are. We're surrounded by lies. Americans are, according to the UN, the least trustful of the developed countries. People don't trust other people and they don't trust their government. Probably because we're the most capitalistic, where everybody's trying to sell you something that isn't good for you and that they pretend is. All those happy people drinking the Coca-Cola that rots your teeth and hurts your inner organs and is very fattening too. But so part of it is that we're constantly lied to, and so we don't trust. And partly is that the government doesn't tell us what's going on. Trump denied we even had a pandemic, and then only later admitted it. By that time, 130,000 deaths had happened in the United States. So that's part of it. Another thing is that doubt has been organized by the right wing, the Pentecostal and the evangelical movement that are kind of Trump's mass base, deny COVID. They are angry at the whole modern world. Now, their anger is understandable. These are people who have been denied, as Americans have lost decent jobs, protections, and a future. But they're blaming science and modernity, as well as people of color and women. And so that they won't wear masks. If the government tells them to wear masks and get vaccines, they won't. They were happy to cooperate in getting their vaccines against smallpox, which everyone needs, against measles, against mumps, against polio. It's not a vaccine, but it's a liquid that you take to stop you from getting polio and keep your kids from getting sick. The vaccines against whooping cough. They were happy to get those because those were a different era where Americans still had some faith that their government was protecting them. There are 5 murderous forces that are working together as a system to sustain American addiction. And those are mainly related to our healthcare system. They're the big pharmaceutical companies, the huge corporations who choose profit over life. They're the big pharmacy chains like CVS, Rite Aid, Walmart, and Walgreens that will hustle pills en masse, even though those pills will kill people. I'll talk about that more later. They're hospitals that make profits and charge outrageous amounts, even when people are sick and can't afford it. They're insurance companies that work with those hospitals and have co-pays that make going to the doctor unaffordable. And they're the doctors themselves who are easily corrupted. So I'd like to talk about all of these things together and separately so that you'll get the idea of why we are the addiction capital of the Western industrialized world and of the wealthy nations. Well, the highest death rates in the United States are in the South, which is also the most resistant to vaccines, the least helpful in terms of a safety net for its citizens, provides the least health care. And those states that are particularly afflicted by COVID are, not surprisingly, Alabama, Florida, with its rabidly anti-science right-wing Governor DeSantis, Mississippi, and Tennessee. The state with the lowest COVID death rates per 100,000 people, so it's not just that it's a small state that it has low deaths, is Vermont. That it has the most vaccinated people per population, and there's 72% fully vaccinated when last I saw, which was a couple of months ago, and has a senator who is a socialist and a strong left presence. Mississippi has had the highest rate since the pandemic began. It's one of the least vaccinated states. 47% of its citizens are vaccinated. It has a terrible healthcare system based on money. So we're talking about evangelicals, Pentecostals, and the right wing who have formed an anti-government, anti-science connection. This connection started happening in 1980, where Reagan, who wanted to turn around the faith in government that was achieved during the best period of America, the New Deal, where big government saved us from a terrible recession. And even though it wasn't perfect, it took 11 million people out of poverty and gave them decent jobs. That would be the equivalent of the United States government hiring 22 million people with our population at decent jobs, rebuilding this country and helping in everything from the arts to public education, to the roads, to the schools, to the universities, everything. Big pharmaceutical companies are a particularly noxious and destructive participant in American addiction. And one case particularly illustrates it. That is the case of Purdue Pharma and the Sackler family, which is a case of cooperation of government and big pharma to kill people. From the beginning, OxyContin boosted addiction on a level that was unprecedented. Since 1995, when OxyContin hit the market, there have been 600,000 overdose deaths. They're not all attributable to OxyContin, but OxyContin gave death a big boost. And it made billions for the Sackler family and their company, Purdue Pharma. The first thing they achieved was they got an approval from the FDA. They got an approval for a 12-hour slow-release painkiller. But even in the studies that they did before applying, the pain pills only lasted between 8 and 10 hours, leaving the last 2 hours people being withdrawn and desperate for more. And yet it was allowed to be marketed as a 12-hour release pill that kept people from pain or cravings for 12 hours. Purdue Pharma also had a highly aggressive sales force to market their drug. They marketed to every little town and every doctor in the United States. Just one example. There is a suit now, and I'll talk about that in a little while, where 80 million prescription painkillers for OxyContin were dispensed in Trumbull County, Ohio alone between 2012 and 2016. That's equivalent to 400 pills for every resident. There's only 400 residents in Trumbull, Ohio, but they got 80 million pills. Wow. Now that is not atypical. little towns all over the United States were flooded with these pills. CVS, Walgreens, and Walmart helped really fuel the opioid crisis. They did it with heavy marketing companies, heavy marketing presence through companies in every pharmacy. And these pharmacies knew full well that in a town of 400 people, they didn't need 80 million pills. Something was wrong, but they were making a profit every time they wrote a prescription. And they had a heavy propaganda and marketing campaign from Purdue Pharma. And so they wrote the prescriptions. Trials of big pharmacies are happening all over the United States. The Sacklers have seen no jail time for all these deaths, the 600,000 deaths since 1995 when they introduced OxyContin. Now, all the overdose deaths weren't due to OxyContin, but a huge share were. And we can see there that money talks. They have escaped any kind of conviction for those murders. In fact, they have stopped their aggressive marketing in the United States, and they, like the big tobacco companies, have concentrated on selling their OxyContin elsewhere and addicting millions of people or hundreds of thousands of people there. Hospitals also colluded in the addiction of the American people. Public hospitals cut hospital beds. For example, in New York, where I live, Cuomo, who recently quit under pressure as our New York governor, touted himself in his weekly reports on COVID as the trustworthy, friendly voice to tell you the truth about COVID. Our hospitals were jammed. Sick people and dead people were in refrigerator trucks outside of hospitals. Sick people overwhelmed hospitals. And Cuomo cut 20,000 public hospital beds in order to cut costs. He did that right before the pandemic because both private hospitals and public hospitals are under pressure to cut costs. In terms of the public hospitals, to cut costs in order to save their billionaires and millionaires for paying more taxes, to sustain public health care, and for private hospitals to benefit their shareholders. And we should point out that only 10% of Americans own any shares, so to benefit the rich people who own the shares in for-profit hospitals. In addition, hospitals cut costs by not providing sufficient protective equipment to their healthcare workers, which is why 3,600 healthcare workers died of COVID. And hundreds of thousands quit. Also, it's why people didn't get good care. Nurses are on strike all around the United States because in order to make more money, hospitals are adding to caseloads to nurses who cannot take care of their patients. And so more people died because they were neglected. It's always the same story. If money and commodities are what define what your life and your business is about, you're not going to take care of people. You're going to take care of profits. Hospital stays are also so expensive now that people who needed to go to the hospital didn't and don't. Another culprit of our five in our interlocking for-profit healthcare system is insurance. For those lucky people who have insurance, the copays can be thousands of dollars. There's a big struggle to have them cover things because their point is not to help you get healthy, it's to make money. So that it's a huge hassle if you can get into the hospital. Because doctors and hospitals and insurance companies work together. Another is doctors. Doctors were actively, marketed to prescribe OxyContin. Doctors got supplements. The lowest was $30,000 for promoting OxyContin. At their little promotion of various other doctors who were served wine and cheese, compliments of Purdue Pharma, those little get-togethers always included a member of the Sackler family's Purdue Pharma, who would report the doctor if she or he did not completely praise OxyContin. Then they would lose their $30,000 base rate bottom supplement. Doctors prescribe drugs like OxyContin that can get people addicted. They did and can. And when those prescriptions end and people are still hungering for pain relief, they go to street OxyContin or heroin or fentanyl. Who is dying in America? Who is adding to all this death and all this addiction? Well, it's the same people. It's the white working class that has been dispossessed and lost hope. It's the people who used to have an honorable place in their community, working for the factory in the community and being recognized as citizens there and able to buy a home and raise children in a decent way, whose factory has been outsourced with the blessings and often the collusion of the US government. We should say that outsourcing began big time under Clinton, who posed as the great friend of unions who elected him and of working folks. When he signed NAFTA, the National Free Trade Alliance with Mexico and Canada, he basically gave the go-ahead for jobs to be outsourced to Canada, where people can, well, not Canada so much really, to Mexico where people earn less, and then to China and everywhere else where wages are the highest in China at $3.19 an hour, where ecological protections in all of those countries, Bangladesh, India, China, Pakistan, where ecological protections are scarce, where benefits are scarce. And so that they were outsourced and their jobs were taken. And the right wing said they were taken by uppity women and people of color, but instead they were taken by American corporations that starved them out. And now they feel hopeless and they have no chance and they feel like failures. It's the middle-aged addiction that has been a big spurt in addiction and death, because these are people who expected to be at the height of their career, having seniority on their jobs, which were decently paid union jobs. In the 1950s, 35% of people were unionized. And those unions gave the strength to many, many other workers to demand higher pay and better conditions. Now there's 10% across the board. Unfortunately, the unions threw out the spark of their unions. The left, the socialists, the communists, the leftists in the Red Scare and they've been dying ever since. And so their jobs were taken. Those were male jobs that paid family wages, wages enough to support dependent wife and children. And these middle-aged wives are also desperate. They counted on raising children, making homes, doing the emotional work, the social work of connecting their men with the families and children and friends, having people over, taking care of their men's emotional needs and sexual needs that would afford them economic protection. Now they have to work outside the home as well as within it. And now they're getting divorced because they can't stand doing two jobs. The family has two jobs if they can get a job. And the jobs that the men can get are no longer jobs with decent treatment or dignity. They're getting the jobs that used to be relegated to people of color, if they get any jobs at all. And so they're hopeless and depressed, and they turn to drugs, and often their doctors give them a pain prescription because they report pain. It's really interesting that the pain centers in the brain are similar for either physical pain or psychological pain. And Americans are in pain more than they ever were before because their physical pain is psychological pain in part, experienced from helplessness and hopelessness about their own future. And these, I should add, are some of the people that support Trump. Trump supporters are usually people who are dispossessed, who don't have a BA, and who don't have much of a chance in life. And so they want to go back to make themselves great again by making America as racist and sexist as it was in the 50s and 60s when they were employed, and the early 70s when they were employed and paid decently, and their lives had more hope. At any rate, that's who's dying. People of color who get less benefits and less chances, and working class white people who have been dispossessed by outsourcing, by a Democratic Party that serves the rich every bit as much as the Republican Party serves the rich, only it throws out some benefits for gender, some benefits for homosexuals and homosexual marriage and so on, and some benefits for Black people, as well as a lot of verbiage supporting those people. A good example of how well that worked was Hillary Clinton, who, unlike Bernie Sanders, wanted to raise the base rate, the minimum pay of Americans to $12.50 an hour. He wanted 15. She's supposed to be a great feminist. 65% of people who work in fast food restaurants and get minimum wage are women, often single mothers. Clinton, who made a big show of having a campaign headquarters at the Hotel Teresa in Harlem, an African-American neighborhood, also canceled welfare as we knew it, and threw tens of thousands, if not millions, of poor women with children into lousy jobs where they could barely make ends meet in order to get a substandard welfare payment. And those were mainly women. So if he was some kind of gender liberationist, he was throwing women, and particularly women with children, under the bus. And the Democrats went for that formula. Give a little on gender and race, and totally deny people, the white working class, of a living wage. And so some of the white working class confuses those pitiful gender allowances as what is given to deny them a living wage. Of course it isn't. It's the Democrats becoming a corporate party and denying those same people who have been denied by the factories, by the law, by the government that allowed this to happen, and are now addicting themselves to ease the emotional and physical pain that they experience. Fentanyl, which is the most deadly thing that people are getting addicted to, was always around, just wasn't being used by addicts. Heroin, an OxyContin is worth 3 milligrams of heroin. Heroin wasn't around, but people weren't overdosing on it the way they do now. Fentanyl was originally an elephant tranquilizer. It's 1 fentanyl tablet is worth 100 grams of heroin. And that means that people are dying in droves from mixing other drugs with fentanyl, heroin and fentanyl, or taking fentanyl by itself. Now, this is all unnecessary. It's all built on a capitalist system, profiteering off our health care, on the collusion of the big 5, the big pharmaceutical companies like Purdue Pharma, the big drug chains selling the prescriptions that will get people hooked, the hospitals that will overcharge so that people can't get proper health care, the insurers, which have copays that are uninsurable, unaffordable, so it denies the importance of their insurance, and from the doctors who participate in this disgraceful healthcare system for profit, and who work to sustain their fees rather than to cure people. Every other wealthy country in the United States that is a Western country, and all the Scandinavian countries, have public health care. We are the only nation that allows direct advertising of medications of any sort. We have to stop capitalism, particularly in healthcare, where it's literally killing people, but also in its push for profit, outsourcing and dispossessing people to the point where they're hopeless and look for drugs to ease the pain because they are in pain. And it's really up to us to help get our word out, to help organize those people who are in pain, to understand that their source of their pain is not directly in the government, nor is it in people of color, immigrants, or women who all earn less than white men, but rather in a capitalist system that has betrayed them. More and more Americans are realizing that capitalism is deadly. There are more people under 30 who approve of socialism than who approve of capitalism, maybe because the youth are the ones that are being denied big time. People with a high school education in the 50s, 60s, and up to the end of the 70s could get a decent job, support a family, have a position in their community. Young people today can't. Even in unionized plants like the GM plants and John Deere, the employers got across dual levels of employment so new younger people could get less. That's one of the things that the tens of thousands of strikers in the United States are striking against. And so we have the worst overdose problem in the world. 100,000 Americans died. The people who perpetrate this murder, like the Sackler family, are not up for murder. They have had to pay several billion, but they made many more billions on selling oxycodone and OxyContin, and they're still marketing it in other countries that are unregulated. That's what we have to stop. We have to stop the idea that profit is the most important thing in life, rather than the opportunities for people to make a decent life, to cooperate together, and to create a better America. That's what we need, and I know we can achieve it. We have the highest death rate from drugs, the highest overdose drugs, and that has been brought to us by collusion of the government with big pharma, insurance companies, big pharmacies, hospitals, and doctors working together in a systemic way in the capitalist system, which we will change. Thank you very much for listening. Even though it's not a happy topic, it's hopeful that we can change it. And we need to know what's wrong before we can do something about it. Thanks to Brian Issam, who produces this program. Thanks to Democracy at Work, who puts it on. Thanks to all our Patreon supporters who make it possible. And thank you for all of you for tuning in, for listening, and hopefully for spreading the word so we can change this together. Bye-bye.